Welcome back to Everyday Kentucky. Youth orthopedic injuries are pretty common, especially in the sports world.
Yeah, that's right. Today, Logan Mattingly with UK HealthCare joins us to tell us more about treating those injuries. Thank you so much for coming in. I know it's a little bit touchy of a subject, never fun to have an injury, but tell us a little bit about, especially right now, we're in fall football season. Are you guys seeing a lot of those injuries, and how should people make sure they're treating them well?
Sure, we're dealing with injuries on a weekly basis, and then especially, what we've dealt with a lot is concussions. You see concussions on the rise in the past couple of years, so you just have to be diligent with that. When you see something, you have to act, kind of take care of all your steps, so a full evaluation, make sure coaches are teaching proper tackling techniques, all those good things. And then as far as the treatment goes, you just have to be diligent. There's a full return to play protocol that you want them to go through, no symptoms, all that good stuff before they can return to play.
How much of that do you think is people just being more vigilant now when it comes to recognizing the symptoms for a concussion?
That's definitely a part of it. So you're trained on it for symptoms to look and see, are they conscious, are they losing balance, loss of memory, vision problems. There's so many things that you have to look for and kind of monitor before you can say you're out or you're returned to play ready.
And that's always such a difficult thing to hear, for an athlete, and to, they obviously put so much time and effort and practice into that sport, and then to hear, hey, you actually have to sit out. I mean, you guys have to tell that to people, unfortunately, a lot.
Yeah, it's always, so a lot of our athletes don't like to see us because they're afraid that we're going to hold them out of competition. And that's not what we want to do at all. We're just there to keep them safe and protect them. So any chance we get to allow them to continue to play, we're going to, but we also have to look out for their safety first.
So someone gets hurt on the field, or maybe a cheerleader, different injuries. How do you determine when somebody goes to just a doctor versus an orthopedic doctor?
Yeah.
So, where I'm in connection with UK, we have a great staff and great doctors. A lot of times, especially at events like football, we're going to have our doctor there to kind of evaluate as well. If I think I need a little extra help, I'll take a look at the athlete, get the doctor over, get a second opinion, and then if we think it's necessary, we'll refer them to our clinic. Sometimes, and it's ultimately up to them. It's their choice. If they want to go see their own orthopedic, then they can do that as well.
What tips do you have for parents whose kids are in sports, just to make sure that they're extra safe and not getting injured?
Yeah, definitely. Just take those precautions. If you think there's anything going on, then definitely treat that. Don't give your kid ibuprofen if they suspect that they have a concussion.
Yeah.
Tylenol is okay within the first 24 hours. But yeah, it's just kind of monitoring everything, taking those steps, and making sure we get the safety first.
And I think there's some ways too to make sure that you're preventing injuries, like making sure that your muscles are nice and strong, and doing those things. How important is it for these athletes, even off the field, to be stretching and doing all that to prevent injuries?
Sure, stretching is a great way to kind of prevent injuries. A good dynamic warm-up before activity, a good static stretch after is always what I tell my athletes to do. Now, a lot of times you have to get that follow through. They're a little stubborn when it comes to stretching.
They just want to get to
it. Exactly. But it definitely does help. And like you said, outside of activity, health and nutrition, good night's sleep, all that goes into it.
We've also heard of issues with athletes who are maybe just so focused on one sport that they develop kind of repetitive injuries. Is that something you all are seeing as far as people going to different sports?
That can definitely happen. I've always said that having multi-sport athletes is a benefit. They're going to train other muscles that they're not getting to use when they're only playing one sport. A lot of athletes at the higher levels will tell you they were multiple sport athletes as well, and it only benefited them going forward.
We see a lot of that. The football players are also track athletes, or baseball players, football, that kind of stuff.
Yeah, it's pretty impressive too. Yeah, because working that, kind of talk about why that is, working that same muscle can actually be bad.
Sure. What we see a lot is, an athlete will come in, they have an injury, and it's due to overuse.
Yeah.
They're not getting the rest that they need, and they think, they're an athlete, so they should just keep going. Your body needs time to recover from all the activity that you're putting it through. So, and that's when they're scared to talk to us. They're like, oh, you're going to make me miss time. you need that time so
Yeah.
your body can recover, so you're
Yeah.
not missing more time in the long run.
Yeah, as a college athlete, rest is so important. You hate to
Yes.
hear it. You don't want to stop, but it is so important.
Yes.
Thank you for talking to us.
Thank you.
Yeah,
We
thanks for
appreciate
having
it.
me.